Welcome to Dr. Direct. I'm Amanda Angelini. Today we're joined by Dr. Tina Discepola. Dr. Discepola is one of the nation's top integrative physicians. She's practiced functional medicine for 18 years and is board certified by the Academy of Integrative Holistic Medicine and by the American Academy of Anti-Aging Medicine. She's also a certified acupuncturist. Dr. Discepola served as medical director of the Hippocrates Health Institute in South Florida. She went on to create the only virtual functional medicine consultation platform in the country. She currently consults with patients across the U.S. We're honored to have her with us today. Dr. Discepola, welcome to Dr. Direct.
Thank you for having me today.
All right, well, we have a lot of questions for you, so we'll dive right in with one from Crystal C. of West Palm Beach, Florida. And she writes, I feel like I constantly have fluid in my ear that I can't get rid of. It's like when you go swimming and get water in your ears, but for me, it never goes away. It's very annoying. Any suggestions for treatment?
So wearing my doctor hat, it is a little difficult to offer treatment when you don't really know what is going on. So the first thing I would suggest is a good ear exam. Family doctor can do it, an ear, nose, and throat specialist can do it, just to get an understanding, is this something that's going on behind the eardrum, or is there just wax, buildup of wax? And either can cause the same sensation. But let's just assume that it is not wax, that it's, maybe a swelling or a little bit of backup behind the tympanic membrane or the eardrum. And a couple of things that I would recommend. So, usually when there's fluid buildup, it has to do with drainage from the eustachian tube. I'm a big fan of chiropractic. And so, for children as well as adults. And so whenever there's a clogging sensation, sometimes not just one treatment, but sometimes a series of just gentle manipulations in the neck area can really keep things aligned and help with that natural drainage that is supposed to happen. And also, there are natural decongestants that one can use. A lot of times folks have allergic or seasonal type of allergies, or it could be some kind of a household allergy causing the sensation. And before you run to the the medications, it's nice to try some of the natural decongestants that are out there. There are some pre-made supplements that are on the market, and they're usually combinations of quercetin, a systemic enzyme, bromelain, stinging nettles, NAC or N-acetylcholine, which when combined really do help alleviate a lot of the clogging and the itchiness or whatever the symptoms they might be feeling in the ear.
Oh, great. Thank you, Dr. Discepola. And would a natural decongestant like that, would something like that be safe for children as well, or would they be safe for just sticking with a chiropractic?
Right. So the natural decongestants might have dosing for children, for certain age groups. Obviously, you'd want to check with your pediatrician first, but chiropractic, it just works wonders with small children, and a lot of folks are using chiropractic to actually avoid getting those ear infections, which are really a result of sort of an accumulation of fluid behind the eardrum, just from non-proper drainage in that area.
All right, well, thank you. It's great to have an alternative that works for kids. Ear infections are so common, so hopefully that will be a big help for Crystal. Next, we'll move on to Dave O. of Athens, Georgia, and he writes, I'm trying to figure out if I have high blood pressure. You'd think this would be easy, but it's not. My readings vary widely, and I have a home monitor. Sometimes my blood pressure is over 140, other times it's below 120. How do I know my true reading?
Yeah, so another case of someone trying to manage their blood pressure, right? Which is difficult to do at home, not impossible, but it is difficult. And so obviously this would require, I would suggest a visit to their practitioner, doctor, or a nurse, and just get a sort of what I call a legitimate reading from an office-based sphygmomanometer. And during that visit, I always suggest that they bring their home monitor with them and do a comparison in that moment. So if the numbers align, you pretty much know that that might be an accurate machine. If they're wildly off, I can assure you that it's most likely the home machine that isn't, quite up to par. And so, so that's one thing so at least you know what your baseline is, and if it's a working machine, that's number one. Number two, numbers vary throughout the day, and just a general non-medical layperson really wouldn't know that. And so when you see 130 over whatever number, and then it's 125, those might be just mild fluctuations that happen throughout the day. So whether you're standing, whether you're sitting, whether you've just come back from a run, morning versus night, there's really a big difference. And I think someone who really is not well versed in the world of blood pressure and hypertension is not going to know that. And that's why they really should consult with a practitioner. But that being said, if this gentleman thinks that he might be dealing with a high blood pressure or near high blood pressure, it's important to live an anti-hypertensive lifestyle, which includes, a really good, solid plant-based diet, lots of exercise, aerobic exercise throughout the day, a low salt intake throughout the day, in those modalities.
Okay, thank you. I've also heard, and tell me if this is true, Dr. Discepola, that getting readings from both arms can be important to see if there's differences between the two, and may help in getting a more accurate diagnosis.
Yeah, well, that is true, and I do leave that for the practitioner to take care of. It's too much of a burden for an individual at home. And so what I recommend is left arm sort of at the chest level. So if their arm is down here, that's not going to work. It shouldn't be all the way up here. It really should be at the level of the heart. So they can just lie it on top, and it has to be straight, and they can just lie it on top of the table. That's what I would recommend. I wouldn't burden someone with sort of both arms or the legs and all of that stuff. Yeah.
That makes sense, but thank you. Great tips for that.
Yes.
Next, we have Darlene M. of Little Rock, Arkansas. And she writes, I'm in my 60s and I've had varicose veins ever since I had my children, but now they're getting worse. Is there anything I can do?
Okay, so in her 60s, so that's a long time to have the varicosities. And I hate to say that they were caused by the childbirth, but having carried the weight inside of your belly can sometimes aggravate a condition that you may have developed over time anyway. So is there anything that you can do? Well, there's all kinds of new laser therapies and non-invasive therapies. So it might be worth her while to go and visit with a vascular surgeon who can do all of the appropriate testing and see which major vessels are affected. So I would, definitely recommend a visit to a vascular surgeon. And before surgery, I would recommend using support hosiery, support stockings, which is going to offer the compression that the legs need. When it's compressed, it's going to aid with the return blood from the legs back to the heart, which is really the defect that's going on there. So there's sort of pooling of blood because the integrity of the vessels has diminished, right? So they become lax and they start to expand. Sometimes they're visible, sometimes they're not. For example, women have sometimes spider veins, and while that looks like a nothing kind of thing, it sometimes is an indicator that there is more of an insufficiency a little bit deeper, and it might not be apparent. And then there are folks who have very apparent and visible and large varicosities, and that can be quite become quite painful and can become inflamed at times, and that's a whole nother issue. She does say that they are getting worse. I don't know if it's worse in pain or if it's simply, that the appearance is worse. So, support hosiery is always a great way to start, and really probably should be, and I'm sure the vascular surgeon would recommend that. Working out, muscle development, sort of low impact exercises. So while jogging might not be a preferred exercise for her, power walking might be, or walking, bike riding, those sorts of things. There are some supplements that are sometimes used by folks. Horse chestnut extract has been branded as a varicose supplement, along with sea pine extract. Butcher's broom is another one, and sometimes those come as a combination. And those sort of help with the swelling that can occur from varicosities and some of the burning sensations that might sometimes happen. So good luck to Darlene on that one.
Great. All right. Next, we have Harold M. of Kellogg, Iowa.
Yeah.
And he'd like to know, what do you recommend as the best natural laxative?
Well, as a doctor, I recommend different laxatives for different folks, obviously, when I'm seeing them. But to answer the question, I like a combination of fibers, soluble fibers, and insoluble fibers. Soluble fibers are like the preparations that they sell in the general stores and the pharmacies, that is powder that you would mix into water and drink. Psyllium triphala is one of my favorites. It's an Ayurvedic herbal preparation. They're gentle on the digestive system, and they are very effective. As well as insoluble fibers, and those would be your fruits and your vegetables and your grains and ground up grains and legumes, and the insoluble fibers act as sort of a pushing mechanism to sort of get the bowels going. So I like a combination of those. I like magnesium. When that doesn't work, I will tell folks to add magnesium citrate, maybe every evening to help with that morning bowel movement. That sort of acts energetically on the bowels to help them move just a little bit faster if they are sluggish. And then obviously if someone's constipated, I'm not opposed to small enemas. I don't like when folks rely on the enemas, then obviously there's a bigger problem. But sometimes you have to just remove the block to allow everything to flow much more freely.
All right. Well, next we have Beth B. of Belding, Michigan, who writes, I'm in my 60s and I went through menopause more than 10 years ago, but I still get hot flashes. They're not as bad as when I was younger, but they're annoying. Is this normal? And is there anything I can do about them?
Yeah, so in her 60s, and she's still getting hot flashes. So, once a woman goes into menopause, she never really leaves menopause. And sometimes women would say, I went through menopause in my 50s. You're still in menopause unless your period comes back. So menopause happens from the time that your period ends, until the end of life, essentially. But when hot flashes are still apparent, it means that the body is still producing little bits of estrogen, and they try, and the levels try to climb up a little bit, and sort of these fluctuations in hormones, which is not always a bad thing, because there is some hormone, left in the pot. But they are sometimes, very debilitating. They can really knock a woman off her feet. They're disruptive. They sort of keep you from doing what you need to do, especially if you're sitting in meetings or if you're in a work situation or social events. It's not a fun event. The first thing I do with my women, my menopausal women, is I eliminate sugar from the diet. And once I tell a woman this, they go, you're right. I'll have a piece of cake and then I'll have a hot flash. I'll drink a soda or some pop and then have a hot flash. Or even worse, I hear a lot, I have my evening glass of wine or a cocktail, and the hot flashes last all night long. And when we eliminate those sugars, because sugar, it can be a hormonal disruptor, it tends to ease the hot flashes. So that's number one. There are lots of little remedies on the market, natural remedies for hot flashes. Some natural herbals that are on the market, and those are fantastic if they work. If they work. I like starting with the diet. I like exercise. I like losing weight, which sometimes goes along with the sugar-free. That helps tremendously. I recommend meditation. If stress is a provoker of hot flashes, which it can be. So I like when women take the time to sort of meditate and ground themselves in an emotional realm, in the emotional and spiritual field. And then at the end of the day, I'm a big fan of reasonable hormone replacement therapy. So if we're lacking in hormones, I'm never opposed to replacing those hormones. So if a woman requires estrogen and some progesterone to sort of improve quality of life, I am open to it as a practitioner, and I wish more practitioners were open to it without the fear. Because not only does it help with the hot flashes, but it helps women overall that are in menopause in all of the organ systems. So sugar-free, alcohol-free, exercise, weight loss, meditation, and hormone replacement for that.
Now, Dr. Discepola, do you recommend bioidentical hormone replacement or the conventional hormone replacement or whatever is best for the individual?
Well, I don't think the conventional is ever best for the individual. I'm a big fan of bioidenticals, which means that the compound that you're taking exactly resembles the estrogen and the progesterone that your body makes. It's structurally similar, so the body recognizes it as if it were your own. I don't use the synthetics. I don't think anyone should. I don't think there's a need for it. And I'm a big fan of topical versus ingesting.
All right, great. Yeah, I've heard, obviously so much controversy over the synthetics. So wanted to make sure we clarified that for, listeners today. So, all right. Next we have Cecilia A. of Amherst, Massachusetts, who writes, I tested positive for the BRCA gene. I decided not to have a mastectomy. I'm looking for all the anti-cancer lifestyle suggestions I can find. What can you recommend?
So positive for those folks who don't know what the BRCA gene is, and when someone tests positive, it means that they're testing positive for a mutation on that gene, either BRCA1 or BRCA2. I'm not sure, nor am I a BRCA expert. But what I do know is that when someone tests positive, and there's a reason why someone would get tested, either a strong family history of breast cancer or ovarian cancer in the family, if there was a male relative, female or male, if this individual, Cecilia, maybe had breast cancer or ovarian cancer, it would have been suggested that she test for the gene. But regardless, she was tested, she came up positive. Women and men who come up positive are not necessarily going to develop breast cancer or ovarian cancer. Sometimes we think it's just breast, but it has to do with ovarian also. But they are at much higher risk than the general population. And so sometimes, when a woman's group of specialists get together, they will recommend removing the breasts and removing the ovaries if indeed the woman has had children. So that's always a decision that would be made between the woman and her physicians, and that would be decided, regarding her risks for developing disease, if she's already had the disease and all of that. She's not going to do a mastectomy, so what does she do instead? Well, here's what I would tell her. Some serious, very serious lifestyle modalities. making some changes in the diet. You're never going to get rid of that positive BRCA gene, but what can you do? What can you change that's going to sort of put the power of that mutated gene sort of back in the closet and not allow it to do its dirty duty, so to speak? What can we do? And there are things that we can do. We can lose weight if weight is an issue. When we lose the fat, we tend to lose a lot of the toxins that are caught up in the fat. If someone is a smoker, you absolutely need to stop smoking. If you've already stopped smoking, yay, and we can't undo what's done, but there are some methods that a good functional medicine practitioner can help you with as far as detoxification. Switching your diet. I always start with the diet, making sure the diet is always organic all the time, plant-based, remove the animal proteins. I'm a big fan of plant-based if we're trying to prevent or sort of combat a cancer. A big fan of fasting protocols. I use that with a lot of my women, not necessarily women who are just positive, but who actively have cancer, and I'll bring that to the forefront. So fasting protocols, and there's so many, but what we do know is that folks who live with low-calorie diets on a day-to-day basis tend to have much longer lives, and their risks of cancer overall much lower. Again, getting back to the plant-based diets, which is going to give you lots of natural antioxidants. If you're not a big, vegetable eater, well, then you can take some antioxidants, and there are many on the market. Phytonutrients, which you can get from a wonderful plant-based diet. Lots of different colors. I always tell people, bring in the greens, bring in the orange, bring in the reds and the purples from fruits and vegetables. That's where you're going to get your variety of phytonutrients to keep your immune function high. Saunas, steam rooms for detoxification. A lot of times we have so many toxins, we're just laden. We have high toxic burdens that obviously mean a lot more when you have a gene mutation for cancer. And so I'm a big fan of the saunas, sweat it out, so to speak, working out and then getting into a sauna or a steam. Dry brushing before you shower every day, just to help with the lymphatic movements. If you're working or going to work with a good functional medicine practitioner, you can do testing to see if you have toxic accumulations, and obviously the practitioner can best help you eliminate those toxins. So it really is a major overall shift. I'm glad she asked the question, and it really is lifelong. It isn't something that you just do for a month or a year.
And not just in terms of cancer risk, right? It would just, that's going to provide you with a good foundation for an overall healthy future.
Absolutely. Absolutely. Mm-hmm.
All right. Next, we have Michael J. of Franklin, Wisconsin, who writes, I suffer from hemorrhoids that cause some pain. My doctors mentioned surgery as an option, but I'd like to avoid it if I can. What's the best treatment?
So, yeah, I think it's smart to try to avoid hemorrhoidal surgery. It's a difficult surgery and can cause lots of pain, especially in that first month after surgery. And so, my feeling is when you have hemorrhoids, so surgically removing them might help in the moment, but what was the cause of the hemorrhoids? Do you suffer from constipation? So I would, avoid the constipation. If you're having a bowel movement every other day, that isn't good enough. And so, obviously, maybe take on some of the recommendations that I made when regarding the question on natural laxatives. So increase your fiber, all of the fibers. Take a magnesium supplement, either pill or liquid, every evening to sort of keep things running smoothly. If you're having one bowel movement a day, maybe 2 is what you need. And I'm not talking about a liquidy stool, a nice formed stool. So that would be number 1. But if he's in pain, obviously he's going to need some local symptomatic treatment. And there are a lot of remedies, both in the health food store as well as in the pharmacy. The doctor might be able to recommend some suppositories, sometimes with a little steroid within the suppository that's going to help just decrease that inflammation and just remove that acute pain, because it is quite painful and very uncomfortable to sit. A lot of women after childbirth experience hemorrhoids and will use a donut to sit on. So that might be an option for this gentleman just until they heal or the swelling decreases. There's a witch hazel sort of swabs and pads that one can use, hemorrhoidal creams that are on the market, both natural and also ones within the pharmacy. But I think when you can have things moving along bowel-wise, I think that that sometimes is a great starting place. And then every once in a while, we just can't get a hold of things, and sometimes surgery really is the only solution.
All right. Well, hopefully that won't be the case here.
Yeah, right.
All right. Well, next we have Tanya V. of Houston, and she writes, "The good news is that my husband quit smoking cigarettes. The bad news is he now uses a Juul e-cigarette instead. Isn't that just as bad?"
Yeah, so this is a great question, especially with all of the youngsters or young adults and teenagers and and adults obviously that are switching, or sometimes not even switching, but just go ahead and using these e-cigarettes. So he quit smoking, so let's focus on the positives, right? So the good news is that the smoking has stopped. So he's no longer bringing the smoke into the lungs and all of the tar that goes along with it. I guess the next step for me as a practitioner, I would say, the next thing we need to work on is getting rid of that physical habit of this, right? So the smoke is gone. He's using a Juul, which is water vapor, which is vape. But there are some studies that show that some of the chemicals within the vape itself can be harmful to the lungs. So it's not something we would want to see this gentleman on for the long term. So if we could figure out a way to get rid of this, and also and then there's the nicotine that's also included. So there's two things now to combat. I would recommend acupuncture. As an acupuncturist, I would highly recommend acupuncture. It is very effective for smoking and for other substances also that are addictive. So a practitioner who's well trained in the NADA protocol, NADA protocol, will know the techniques for smoking cessation. Hypnosis, I think, is effective. I've had many people try hypnosis. And if the nicotine is still an issue, he might consider maybe switching to the nicotine patches, the Nicoderm patches, where you dose down. So it takes you from one level of nicotine down to a lower milligram dose, until you eventually wean off of it. Just keep trying. And even if you don't make it, try and try again. It's that important. Our lungs are so important. And so it's definitely a tremendous investment in your health. Getting rid of the smoking and then ultimately getting rid of these e-cigarettes.